Good evening. We'll start that again since we're in broadcast mode now. So it is right at 6:01. For those of you that are in the room, welcome. And we've got folks online. And so what we found Monday night is that it takes folks just a few minutes. So we are going to give the folks online just a little bit of time to log in. Plus, it also lets us check the sound for folks online. And our interpreters told us it's good. For those of you that are here, one of the things is just a housekeeping. I forgot to do this Monday night, is where the restrooms are. It's extremely important. So if you will go out the door by the desk and then turn left and go down the hall and then turn right, you'll find the restrooms there, which are extremely important. And then there's water in the back as well. So we will start just in a few moments. All right, for those of you that are online, we are just going to wait a couple of more minutes for folks to log on, and then we'll be starting. Good evening, everyone. We're going to go ahead and get started. Thank you for your patience. I heard there was an accident on 70, so we also wanted to give time for folks to get here. But we'll go ahead and get started with some housekeeping as folks are slowly coming online as well. So good evening, everyone. I am Renee Averett Sanzoni, and I'm with the Parents Place of Maryland, and I'm going to be your facilitator tonight. So I'm really looking forward to it and appreciate everyone's patience because we're also doing this with about 67 people online with that. So what we'd like to do is welcome you to the Western Maryland and the Central Maryland Regional Office DDA Community Meeting Collaborative Conversation Sessions. We have a few housekeeping. Next slide, please. There we go. We have a few housekeeping things for those of you that are online. If you are needing closed caption, please see the CC on the bottom right hand of your screen to turn those on for yourself. Mics and cameras are turned off while we do the share the comments and from the listening sessions. You will see in the top right-hand corner, you will click here to post a comment or a question, which I will be monitoring. And then when it comes time for the question and answer session, you'll see where you, bottom left, where you can raise your hand to ask a question out loud. All right. Conduct. So we really do understand that this is a very emotionally charged as well as a frustrating time for families and for providers. And so we just really want to acknowledge that and really talk about some ground rules for this evening. Oh goodness, this evening, as well as the conduct that we really expect from everyone. The free expression of diverse viewpoints is a fundamental value of our group. This freedom carries the responsibility to engage respectfully, which means treating one another with dignity and respect in good faith. Uncivil behavior, disruptive actions, abusive language, threats, or harassment will not be tolerated and may result in the removal from the meeting. So we have some group norms because again, we've got around 69 folks online as well as you all that braved the cold and the wet to come out tonight. So we do have some norms for respectful participation. One voice at a time. Everyone deserves to be heard. We ask that you please limit the questions to 1 minute so that we share the space so all voices can contribute. And we want to listen with respect, avoid interruptions, and honor each speaker's perspective. All right, so I'd like to start with our agenda for the evening. I have welcomed you, and now I'm going to turn it over to our DDA folks for them to do an introduction, starting with Marlena.
Good evening, everyone. Thanks for joining us this evening. As Renee said, coming out, weathering the weather and the traffic at large. Thank you so much for coming out to talk with us. We hope that you are able to share any thoughts, any perspectives, ask us questions. We're really looking forward to the collaborative conversation. So, I'm Marlena Hutchinson. I'm the Deputy Secretary for the Developmental Disabilities Administration. Thanks to you all online as well for joining us this evening.
Good evening, everyone. My name is Robert White. I am the Chief Operating Officer for the Developmental Disabilities Administration.
Hi, I'm Kathy Marshall. I'm the Western Maryland Regional Director. I welcome you, and it's nice to see some faces I know.
Hello, everyone. I'm Bianca Rennick, the Regional Director for the Central Maryland region, and glad to be here.
Hi, I'm Linda Yale. I'm the Deputy Director at the Western Region Office.
Good evening. My name is Rhonda Workman. I'm with the Developmental Disabilities Administration. I'm the Director of Federal Programs.
Good evening, everyone. I'm Nova Evans. I'm the Director of Cross Systems Innovation at DDA.
Good evening, everyone. My name is Mary Jenna Sazur. I am the Deputy Director for Administrative Services. Welcome, everyone, in here and also online.
Good evening. Welcome, everyone. My name is Joseph Kamara. I'm one of the DDA staff. Thank you.
Good evening, everyone. My name is Eric Feaster. I'm part of the professional development team for the DDA.
And my name is Eugenia Romano, and I'm IT support.
All right, I think that's everyone. So we've done the introductions, and so really what we want to move into next is the part where we have DDA share. So there were a series of listening sessions over the last few months, and they took all of those comments and they've organized them, and they're going to share them with you. And then after sharing, then we're going to lead into this collaborative discussion and the opportunity for you all to ask questions. We've got mics, so running around, or you're welcome to come up. But I think running has worked really well for us, so we're happy to do that. So I'm going to turn it over to Marlena to get us started.
So, hello again. Just to go through the agenda really quickly, we're going to talk about how we've heard you and what we're doing as a result of those 6 listening sessions that we had. We started a town hall in September of 2025 and had 4 or 5 listening sessions, a total of 6 altogether, one also being an all Spanish speaking listening session for DDA. Next slide. So, by way of those listening sessions, we received a lot of common themes from the community, and we really appreciate the feedback that you provided us. And one of the things that we heard, in one of the reasons why we had listening sessions is because we heard from the community would felt that DDA was always talking to the community and not giving the community an opportunity to talk to DDA and have conversation or dialogue with DDA. So we hosted those listening sessions. There are 5 cross regional areas for improvement that we pulled out of all of those feedback and comments that we received and that we synthesized. One is communication failures. Another is damaged trust, confusing policy changes, a complex system, and a desire for genuine partnership. So we're going to talk about those 5 themes tonight and then open the floor up for additional discussion. Next slide. So communication failure was one of the primary ones that we heard in regard to DDA having a primary failure point with communication, inconsistent and incomplete information shared with the public, and limited responsiveness from DDA and from MDH as a whole. Next slide. What we're doing. So we are working very closely with our partners within the department as well as outside of the department to make certain that we strengthen our partnerships with case management. As you know, the coordinators for community services, they're one of our agents who that act on our behalf. Also, our fiscal management and financial management and counseling services agencies, our Medicaid partners, and we're making certain that we align more closely with them to make certain that the messaging is consistent and that training materials are updated with the most recent policy changes. Another thing that we're doing is establishing clear expectations for timely responses and follow through. We call these service level agreements within the department. Another thing we're doing is standardizing communication channels and our messaging content to ensure consistency. One thing I did hear across all regions was the regions are doing things differently. You're hearing different things from each region depending on who's reviewing an application or person centered plan. So we're standardizing communication in that regard. Another thing that we're doing is improving proactive, being much more proactive in our information sharing to the stakeholders and making certain that we receive updates, we receive information and make timely updates as we're working with our community partners. Next slide.
Thank you. For damaged trust, what we heard is that trust has been significantly damaged due to rushed processes and limited transparency about the reasons for changes. So what we are doing, we are also creating more structured opportunities for partners and stakeholders to engage with DDA on an ongoing basis. This includes standing groups like the Waiver Advisory Committee and the Maryland Intellectual and Developmental Disability Sustainability and Equity Committee, or MIDSEC, as well as our broader listening sessions and community meetings. These platforms gives us more frequent touch points with the community, and we expect to expand our engagement efforts even further in 2026. As part of improving how we work together, we are also being more intentional about pacing our decision making. When feasible, we are slowing down key decisions to allow time for dialogue, and we are communicating timelines in advance so stakeholders know what to expect. We're committed to providing clear explanations for both proposed and implemented changes, including the data, goals, and constraints that inform them. Most importantly, we want stakeholders to be engaged earlier and more meaningfully before final decisions are made. To support that, we are strengthening our feedback loops to ensure that questions and concerns are not only heard, but responded to transparently. This approach helps us build trust, improve shared understanding, and ultimately make better, more sustainable decisions for the DDA community.
Slide. Um, Confusing policy changes. So that's another theme that we heard in regard to how the community is feeling very confused by DDA's policy changes, and that the DDA needs to be much more cognizant of the unintended consequences when there are changes, because those unintended consequences could result in service disruptions and lack of clarity about administrative and reimbursement requirements. Next slide. So what we're doing, we're clarifying our policy language. We are publishing updated guidance in plain, consistent formats, as well as translating documents into Spanish in an effort to make certain that our resources and materials are more accessible. We heard a lot from our Spanish-speaking community in regard to accessibility. And so we are making certain that not only are we beginning to translate more documents in Spanish, that we are translating in other languages as well. We're hosting targeted training, webinars, and question and answer sessions to ensure shared understanding. We are identifying and addressing unintended impacts, and we're getting that information from the multiple forums that we have in place, and especially around those affecting service continuity and quality. Last but not least, we are establishing a structured feedback process, again, by way of these multiple platforms before future policy changes are finalized.
One of the major themes is DDA is a complex system. What we heard is the system remains overly complex and inaccessible, especially for families. Just wanted to make sure we're in the right slide. With language barriers and varied cultural dynamics, as well as aging caregivers. So the DDA, we are also working to simplify the way people interact with DDA by streamlining processes, forms, and guidance so that administrative requirements feel more manageable for families, participants, and providers. At the same time, we are expanding our culturally and linguistically appropriate communication efforts. DDA hosted its first Spanish-speaking listening session on November 10th, and we are actively translating key documents related to the October 2025 waiver amendment into Spanish to improve accessibility for the community. We're also looking at other languages, some of the other top languages in the state as well. Additional Spanish language translations are already in progress and will continue to be released. We recognize that meaningful engagement also requires meeting people where they are. So we are strengthening partnerships with community organizations that serve diverse families and can help improve outreach and cultural navigation. We are also exploring ways to offer more supports tailored to aging caregivers, including clearer pathways to the resources they need as they plan for the future. Across all of this work, we are reviewing our policies and practices through an equity and accessibility lens and making changes where the findings show opportunities for improvement. Our aim is to build a system that is not only easier to navigate, but also more responsive, inclusive, and reflective of the communities we serve.
And last but not least, the another thing that we heard was the community wanting and desiring genuine community partnerships with DDA, and they want this through work groups, regional meetings, and visible feedback loops. So what we're doing, we are actually sharing our meeting summaries, our timelines, and our next steps so that all community partners can track our progress. And we're also evaluating our engagement practices regularly and adjusting based on stakeholder experience. Since July 1, the DDA has hosted a number of virtual as well as in-person community engagements. We've been around the state in every region. Again, thank you so much for coming out tonight to engage with us. We've hosted about 44 different live webinars since July 1 and engaged in about 36 in-person community engagements. So we're hoping that you're beginning to see and feel our commitment to building this community partnership with you all. Next slide. Renee?
You. All right, it is time now for the collaborative discussion. So questions and comments. A reminder that everyone will have 1 minute to share your question or your comment. And please keep in mind, will not be able to address participant issues, may not be able to give updates on behalf of other departments or entities, but we'll take the information back as appropriate, and will not be able to address questions related to the ongoing fiscal year 2027 budget process. All right, so let's go ahead and get started. We already have a question, comment online, so we'll get started, and that'll give you guys in the room a chance. So this is the question. Since the region is basically rural, DDA needs to be reminded that transportation and weather are different in this area. Most do not have cab service nor a bus transportation. Sometimes roads are closed. Also, weather related to employee and employer safety is never a concern for this region. Policy specific to a region would be considerate and show concern for safety.
Thank the community partner for sharing that information. We'll definitely take that into consideration, especially as we continue to build out our community platforms.
Thank you so much. My oldest brother is Down syndrome, and he developed cancer a few years ago. And I came into from LA to help my parents out who are aging, and I never left because I saw how fast they're aging. We're at the point now where he has live-in care, but we need to start considering what it takes to transition over to awake overnight because there are things that have come up that he needs to be supervised more often, and I wanted to know what is the best way to go about that process.
Thank you for bringing that to our attention. Get in touch with the CCS. Do you know who the CCS is? The- Oh, I'm sorry. I'm sorry. The Coordinator of Community Programs, the Targeted Case Manager. Do you know who that is? It's the person who does, yes, yes. Start with that person so that you can have a meeting, develop a new plan, and then get that into the regional office. And if you need some additional resources while you're, trying to work your way through this plan, reach out to us. Which region are you in? You're in Central. That's Bianca.
He knows how to find me. He knows how to find me. He'll give you my number. He knows how to find me.
Sure.
But the situation with the experience is because of the Evie's portion. Because he had went to the hospital, and he went to the hospital as an emergency situation. But this is at the beginning when all the codes and all that stuff was brand new to us. So the family had to use to make cover. It was like he had to be like supervised for like 10 to 15 days. But so during that time, the staff, we didn't know what code to use. So with the code, the staff just used the codes that was available to use. So it automatically threw the budget off. So then at the end, the parents, the staff, or others, the line item started bleeding. So he couldn't get the staff had to go how long without getting paid? Because of the fact of the emergency situation.
Have the CCS reach out.
Okay.
Yeah, have the CCS reach out to me, or you can reach out to me directly, and we'll review the situation and provide guidance to help you figure it out. Okay, you're welcome.
Thank you. Other questions and comments? I actually don't have any online.
Maybe build on the question when you said you had a participant that went into the hospital and DDA care was still being provided to the individual that was in the hospital after he's came back. Yeah. It's okay.
It's fine. No, you're fine. Go ahead.
So, to build on a real life situation where I had a family member that was a victim of a violent crime, went into the hospital and ended up in um, rehabilitation centers for 65 days. We were then removed from the DDA system because of obviously some type of overlap in coverage. If you think about it, there's probably have never been a more a time needed for care while the individual was in rehabilitation. So I'd like that, to be addressed. And it did occur in the Western region. If policy has changed, or is it an action that we can take for future?
So first, very, very sorry to hear about your family's incident in that situation. When you talk about hospital stays and then long-term stays in maybe a nursing facility or rehab center, it's a Medicaid eligibility requirement to disenroll the person from the waiver to get the person enrolled into those long-term services so that the nursing facility or the institutional provider can be paid. We can certainly talk with you about your incident in particular to make certain that anytime care coordination needs to be addressed, we can certainly look into that. But because of how reimbursement works for Medicaid eligibility overall, that's likely why your family member was disenrolled from the Community Pathways waiver because they had to turn on the long-term care code so that the nursing facility or the rehab could be paid.
Coming out of it, then it took we had to reapply and go through the whole application process over again. And so it was about 60 days that we ended up covering, our own services out of our own pocket through like a visiting angels or something like that. And I think administratively that could have been handled a lot better.
Thank you for that feedback. Definitely something we can look into as we work with our Medicaid partners to streamline processes, make them much more efficient and effective. Thank you.
Hi, my name's Denny, and I'm a father and I'm a support broker. So I experienced something here on both sides of the fence that just really gets me is the relationship between DDA and EDD. My son got dropped out of the program accidentally for 12 weeks, and I've had a few of my clients where they all of a sudden were dropped out because EDD didn't do their job. So my question is, what is DDA doing to ensure that we as families and other families are alerted to this in enough time to do this recertification, which I think is foolish. If our children, my son has Down syndrome, he'll never, come out of the program, but why do we have to recertify him every year? It just does not make any sense. And there's so many of our kids that I'm pretty certain, I'm safe to say that they're never going to come out of the program. They have a disability that's for life. So this having to recertify every year is just ridiculous in my opinion.
Thank you for sharing your experience. So first, in regard to Medicaid eligibility, we at DDA, we operate a Medicaid waiver program. And so there are Medicaid requirements that require families or participants to recertify annually. So that's a Medicaid requirement. It's not a DDA requirement. And that's based on the Code of Federal Regulations as well as our federal authority by way of the Community Pathways Program. Now, in regard to the administrative challenges that you and your child experienced, it is unacceptable. And we have heard that from many families and from many participants. And as such, we are working very closely with our Medicaid partners to, again, look at our processes, streamline them, make certain that our case managers are informed. We're taking a proactive approach with our case managers in regard to training to make certain that families are aware of this recertification process. I do know that Medicaid sends that recertification notice 75 days in advance. And so we are going to be working on a campaign with Medicaid to make certain, please check your mail. Please, if you have any questions, reach out to your case manager, be it your coordinator of community services, be it the eligibility determination division, be it our regional office. We're one MDH, and so anytime there is a glitch in any part of the system, we're working together to address it. So I really hate that you experience that. Totally understand. It's something that has been a flag for us, and we're working very closely with our Medicaid partners on that. Thank you.
Great, thank you. So I see your hand, and your hand, but I also have folks online. So let me take a question from online. So I am apologize if I mispronounce your name, but you have your hand raised. Is it Sachita Gupta? If you could unmute yourself and ask your question. So what we'll do is we'll come back while you're working on unmuting yourself to ask your question.
First, tagging on to what the last person just spoke about the eligibility and determination. I know that, I have a very good CCS or support coordinator. I never know which terms they're using, which initials or whatever. But I know when we were submitting, um, like you said, they give you a 75 days, get the letter. Um, she heard or found out somehow that what they really want is they want it in 45 days before the deadline. And if you don't have it in and all your ducks in a row and all the paperwork and every documentation in 45 days before the deadline that they gave you, there's very likely to be interruption of services because something about where it will run out before they have a chance to renew it. And then sometimes they have to do an extension. I forget what that's called. Fortunately, we didn't run into that because I have a really good support coordinator. Um, but I've heard so many stories where then there was this gap where the old plan ran out, the new budget and the new determination and things, and so that's just, one thing to know that when they give you a deadline, don't wait till the deadline, get it in as soon as you can. Okay. Um, the other concern I have is with it almost seems like, and I'm sorry if I offend anybody, but with a lot of the DDA changes, that they're trying to almost get rid of self-directed or weed people out of self-directed. I know that's a very common belief among families. Um, and like all these changes, all these services that are being cut, all these extra hoops to jump through that some, don't even seem to make sense. Like you have to hold 3 interviews and then give reasons why that nobody was qualified and other things about, expecting the participant. We're talking about people with developmental and intellectual disabilities. Okay, yes, they're the participant, but most of them don't have the capabilities to do the things that are being required of them in the new manual and stuff. They just aren't. It's going to be the parent, it's going to be staff, it's going to be the support broker or somebody like that. And I just often wonder, like, it's DDA. Do they not understand what a developmental disability is when they're making some of these policies? I don't understand. So kind of keep that in mind, when you're saying the participant should do this or that, they're just not able. In most cases, they're just not able. That's why they are disabled. That's why they have developmental and intellectual disabilities. Um, so that's another point. Okay. If you want to address that.
Yeah. Yes. Remember, we're trying to limit
1 minute.
it to 1 minute. Okay. So everybody's voice gets heard.
So, in regard to the eligibility and enrollment process, it is a concurrent enrollment process, meaning the DDA is responsible for managing the medical and technical components, and the eligibility determination division within Medicaid is responsible for handling the financial components. With that, the CCS and all family members should please abide by what EDD's letters say. They mail them out 75 days in advance to accommodate for snail mail, for mix up in mail, for those of us who may think it's just some advertisement that really doesn't warrant our attention, they mail it out in advance, 75 days in advance, and then they mail it again. EDD does have processing timelines, and what we're doing is we're going to be inviting EDD to our case management trainings and meetings so that our case managers have a better understanding of their eligibility and enrollment process. I do not want anybody to think that, to your point earlier, let's just hold off based on what a case manager in DDA says, because it could be miscommunication. So we are going to be having EDD come to our case management trainings to start educating all of us on their processes and so forth. So thank you so much for please stressing that whenever you get the mail, please read it and please respond to it. In regard to self-direction and the future of self-direction, please know self-direction is not going anywhere. It is a very important service delivery model for the Community Pathways Waiver and for all 4,000 people who are currently enrolled and those who will become enrolled in self-direction. It is a service delivery model that the DDA has petitioned CMS to continue in its Community Pathways Waiver. As you saw, we had 3 Medicaid waiver programs. We've consolidated into one. Self-direction remained there. We are confident that we can continue to work with the community to make certain all of these things, the uh, the rumors and so forth about self-direction going away, we will quash that as we continue to work with the community.
Thank you. So I'm going to go online and I see you all. So Mimi, I see that your hand is raised. So I'm going to put you on deck and I'm going to read, and I'm hoping I'm pronouncing your name correctly, Zipporah Frager. It says, so how can DDA put a plan in place so that there is a smooth transition from nursing home to home care? A nursing home is only allowed for 30 days.
So there is an existing transition plan that the case managers, the discharge planners at the nursing facilities or any institution a person is discharging from, as well as the DDA's case management network. What we need to do here is just look into that process, make certain that we continue to ensure that it's streamlined and efficient for participants.
All right. Mimi, can you unmute yourself and share your
Hi,
question or comment? Thank you.
thank you. Um, Hopefully you can hear me. Can you hear me all right? I think it's
Yes,
working.
we can.
Okay,
Thank you,
sorry.
Robert.
Wasn't sure if it was frozen. Okay, so I have two questions, both in regard to equity, as we're moving like forward towards more equitable services and service delivery. Just a little bit of background, a tiny bit, promise it's quick. For one of the questions is that Maryland's poverty rates vary a lot across Maryland, with drastically higher poverty rates in the far western region, the southern eastern region, and it's at its highest in Baltimore City. With higher poverty rates, there's also less community resources that are available, and people are led to pretty desperate measures. So the first question in regard to that is, what is DDA's plan to address equity in areas that have high poverty rates? The second question is, what is DDA doing to ensure that there is equitable representation of people who are receiving services on the different councils and committees that are helping to guide DDA in this transition period?
Thank you for those questions. I will be turning it over to my director of our new clinical innovation systems. But what I want to say is that our strategic plan for this fiscal year places an emphasis on equity and also meeting the underserved communities where they are. We have redesigned our what was formerly our programs team into our clinical systems innovations team, and within that team is a subset of people who will be focusing and working with organizations that represent the underserved communities. Um, and we are also making a concerted effort to make sure that we are advertising and or communicating with underserved communities when there's opportunities to serve on committees such as the MIDSEC, which is the Maryland Intellectual and Developmental Disabilities and Equity Committee. And that's also within the scope of that committee to help to address some of the issues that you flagged. I was going to turn it over and see if Nova, our director of clinical systems innovation, had anything. Cross systems innovations uh, team.
Thank you. Sorry. Oh, yeah, project. Thank you. Yes. Um, Part of our team, right, is the clinical team. We have lifespan supports, which looks at services from birth to aging. We have our provider services and our CCS team is there, and our innovation. So we do assistive technology, employment, housing, and other innovative strategies. So as part of the new cross systems innovation team, we are making extreme efforts to go out into the communities, meet new providers, meet new people where we weren't able to do that in the past, and work across systems. So not just DDA, but with different agencies, partner agencies, and community members. So you'll be seeing a lot more of that. You'll be hearing from us. We're reaching out to participants. If you have ideas of how we can partner better with the community, bring them to me, bring them to my team. We're really excited about this new effort to get out in the community and really focus on equity. It's a very important thing for us. So
And since we operate a Medicaid waiver program, we partner very closely. The entire DDA leadership partners very closely with our federal partners. And so I would like Rhonda to speak about how we put together the Waiver Advisory Council, making certain that there was representation there and so forth.
Yeah, thank you, Marlena. So as Marlena was mentioning, we have the Waiver Advisory Council. It's a diverse group, which includes people with lived experiences, family members, to include that representation from our different regions so that we can have that in addition to case management representation and providers. So we're actually looking for additional members. So if you know someone who'd be interested, we're looking for family members and people with lived experiences. I'm available. I can talk to anybody afterwards and help to connect you with that. But we're always looking for a diverse group of people to help us and advise us related to the Waiver Advisory Council.
Last but not least, I have been going out to actually visit participants in their homes as well as visit providers, working very closely also with legislators, understanding where the underserved and underrepresented populations are. So we'll continue to do that as well. It's a part of, I think, 36 engagements that I've actually done myself this year since July 1 of the fiscal year. So again, any additional recommendations as to how we can get out to meet with individuals in those underserved and underrepresented populations, we're certainly open and welcome to do that.
All right, thank you. So quick question that was online while I walk over here, because I think you were next. Still have a question, comment? Yes. What does EDD stand for?
Eligibility Determination Division, and that division operates and works under the Maryland Medicaid Administration at the Maryland Department of Health.
Yeah. My name's Elizabeth LaFrance, and my question is that, sorry, FMS payment delays and non-payments are a significant issue in self-direction. it's clear that these payment issues are service denials. And what is the DDA Medicaid appeals process for FMS payment delays and denials?
Yeah, Liz, hi. Nice to see you. And I believe this was a similar question that we had on Monday. And Monday night, we had shared the service is not being denied. The service was authorized by the DDA through the Person Center Plan. There are processes related to the invoice process for payments and information that is needed there. Monday night, we had Wesley Huntelman that was available, was able to join us. He is the Director of Administrative Services and oversees the Financial Management Counseling Services. Mary Jane is here. She's the Deputy Director. But we can take information back, and we've asked that people reach out so that we can follow up on any concerns related to the financial management and counseling services.
No, and in fact,
That's okay. So without, if, I mean, there are many times things don't get paid or they're delayed. And if you say, well, the FMS has told you what the problem is, you're assuming they're always correct. They're not always correct. There's many times where, not many, but they're often correct, but they're not always correct. It's incorrect to assume that, and that is why there is an appeals process. You wouldn't need an appeals process if they were. Uh, you know, you have rights. You have the right to appeal, and so there should be. People don't know. Oh, you should. Yeah, I mean, they say you should contact the regional office, but what is that process? Like, if we don't get an email from the FMS saying what to do, we don't know what to do. And there was a point where the DDA did that, I forget what they call it, but they made an effort to resolve these issues for people. So we know it's a problem. And how is that problem being addressed? It seems like there's no one, we just don't know what to do. When there's an obvious issue, we're making no headway. And I believe there should be, it should be very clear what people are supposed to do because they don't know.
sure, I would just say that we do not operate based on an assumption that the FMCS agencies are correct. We will share a dedicated email address in the chat here and with you. I believe it's sds.dda@maryland.gov. Um, Mr. Wesley Hunteman, who Rhonda mentioned, is our Director of Administrative Services. He is also the contract monitor for the Financial Management Counseling Services contracts and the escalation point. And many times these issues are even escalated to my level and I get involved and we make sure. So they're obviously within their scope is to ensure that all payments are proper. Sometimes, they may deny a payment because they're missing documentation or something to that respect that usually doesn't tie back to a service that's in the plan, which, any denial of those services would come with appeal rights. Many times it's working through a misunderstanding. Sometimes it's because a budget is depleted or the units are depleted. So, there's just a myriad of reasons a payment can be denied, but we are always there as the escalation point, and we do get involved and we do help resolve payment issues that are appropriate.
I would also like to say, and we want to make certain that we get others in the audience here. My team meets with the financial management and counseling services agencies every week, and so when we are hearing these kinds of things, either by way of the dedicated email address or by way of our regional offices, one point of contact with the fiscal financial management and counseling services agencies is that weekly oversight meeting with all three agencies. So we'll definitely look into this for you. Need to take this. I would like us to be courteous to others in the audience, please. Thank you.
Thank you so much for your comments, but let's please remember the ground rules, okay? Got a question back here.
Yeah, thank you so much for hosting these and for the listening sessions. My question to you is, and I apologize, I may not have all the lingo correct. Um, as a parent, I always look for, certifications, right? Agencies. Um, is the Maryland DDA working with the Council of Quality and Leadership for certification, or are we currently certified?
We are not accredited. We are on the road to gaining the Council on Quality Leadership accreditation. So, but we are on track.
Where are we in that process?
We're
We do have an agency that is certified in Western, and that is Community Living. I don't know if you're familiar with Community Living. They're here in Frederick, and they are already certified. They went the path and decided they would do that before they got the global certification.
So they're CQL certified?
Yes.
Okay, great. And then is CQL one of the agencies that DDA is working with to make some of these improvements that you've talked about?
Yes, we're working with our quality improvement like organization, which is Liberty Healthcare, and they are working with the Council on Quality Leadership to help the state attain accreditation.
Thank you.
Providers are they gain accreditation independent from the state.
All right, let's get some online folks and then we'll go back into the room. This is from Connie Wetzel. It says, would DDA please send out more surveys and questionnaires to all stakeholders before changes are made and to check progress and status of their effects? That way we all feel like our voices matter. Many potential problems could be avoided proactively. We should all have a voice, not just through work groups and email. An email makes that a viable option. Thank you for considering. All right, another question. Does Maryland and DDA have people advocating lobbying the federal government to change the cost matching requirement to be eligible for federal funds? What cost cutting options is DDA considering? Rumor is going around that eliminating or limiting FASs or legal guardians as staff is one thing DDA is looking at. Will the entire body of stakeholders have a vote on the best ways? Does Maryland's DDA have people advocating lobbying the federal government to change the cost matching requirement to be eligible for federal funds? What cost cutting option is DDA considering? And then rumor is going around that eliminating or limiting FAS or legal guardians as staff is one thing DDA is looking at. Will the entire body of stakeholders have a vote on the best ways?
So in regard to the first question, the DDA petitions the Centers for Medicare and Medicaid Services to operate a Medicaid waiver program. That uh, that federal financial participation rate, known as FFP, is 50% in most instances for DDA services. We do not lobby or advocate for more. That rate is established by the Centers for Medicare and Medicaid Services. In regard to anything involving the fiscal year 2027 budget, we are unable to speak on that at this time.
Okay, thank you. All right, another question, and then we'll go back into the audience. My son was DDA approved, however, informed them that he no longer needed the services. DDA did not confirm with me and got rid of the services. We are now having to go through the approval process again, which has been lengthy and challenging since he's already approved. I'm wondering why we cannot resume from where we left off to help expedite the process.
I think we would need to know more information if that person could get in contact with their respective regional office and share the participant identification number. They can research the case and offer some assistance.
All right, thank you. And if, yes, thank you. All right. Yes.
The only reason I was raising my hand is I really want to commend DDA for what you all are doing. I see the changes. I've been a support broker for over 20 years, so I'm seeing all the changes and everything. So I really want to commend you all for the changes. And I just didn't want to be rude by leaving, but the young man is an emergency situation, so I would stay here and want to listen to everything, but I definitely want to commend DDA for the changes. I see.
Hi, I have two questions. One is regarding vendors and which vendors have to become providers. Do small sole proprietor farms need to become a provider to continue to provide services? It seems like a very onerous process. My son has participated in a farm that is a sole proprietor nonprofit for 12 years. And we're now being, what we've been told so far is that person to continue would need to become a provider. That is a ridiculous endeavor for her. It's too onerous for her to continue to do that. Um, and we'd like to know which vendors actually have to go through that provider process. That's my first question. My second question is, will anybody say on the record that family of staff is safe? Because we're hearing a whole lot of stuff about family of staff being removed because it's a big expense and that um, family of staff takes advantage of the situation. And quite frankly, I've been dealing with this same question for 12 years and it's getting a little old. I provide better service than anybody else. I know my son better than anybody else. I'm the one that makes sure he has volunteer positions. He doesn't have a job yet, but he has volunteer positions. He gets job skills training at that horse farm. He goes where he wants. He does what he wants. He's involved in his community. He wants to stay that way. I would like on the record somebody on the panel to tell me the family of staff is safe, that it's not on the chopping block, because it doesn't look like we're safe.
So just to answer the vendor question related to that, the federal authority indicates what qualifications for the different types of services. And we know there are different vendors or entities that are being used for goods and services. So happy to connect with you to get more information so that we're informed and can look at that. Currently, there is an effort related to supporting what we call our sole practitioners to become Medicaid providers. And so that would be our nursing support services and our behavior support services. So that's the effort currently that's underway. We absolutely want to ensure that they're qualified providers, whether they're employees, vendors, or DDA providers, to provide the services and supports as per the federal authority, the waiver application. Um, I have self-directed services under my purview. And so in terms of the family of staff, I can tell you that that is in our federal authority, that relatives and legal guardians and legally authorized representatives can provide services and supports. And that is currently in the waiver and our manual. So those services can be provided by relatives.
All right, thank you. Got a question online. Is DDA able to host an application seminar for providers looking to work with DDA? The application itself is very long and confusing for us and holds many back from completing this process.
So actually, we're looking into that right now, creating a orientation for providers. I would say at this point, if you have questions about provider services, applying to become a provider, you can reach out to your regional office provider services staff, and they're more than willing to assist you with that. You can reach out to me. I have the provider services. We have all that information online so that people can access that. But we are also looking at orientation. I think that's really important, that we're getting qualified providers and they're able to have all the information they need up front. So in the works.
All right. I thought I saw a hand. Yes.
Okay, sorry.
Thank you. And thank you to the DDA for recognizing the nurses and BSS issues with the providers and all of that. That has been a big, aha moment for us. And we're able to breathe a little bit going into the holidays. So thank you guys for recognizing that issue. My question this evening is about participants with medical complexities. One of the things that we're seeing a good bit is individuals with medical complexities being denied services that they've been receiving for years, 12 to 15 years. Diagnoses haven't changed, nothing has changed. Um, Many questions and we're not receiving any answers. This has been resulting in 2 plans being denied and a serious stress on the participant and their families as far as where to go to next. It's also resulting in families having to take out personal loans to hire legal representation with an already burdensome task. So if you could please shine some light, because we continue to ask questions and we're not receiving those answers. So would love some feedback. And just to elaborate a little bit more, my suggestion on this issue, as many as we've met many times, is to, instead of denying, and if there is such an issue that is happening, there should be a plan in place that if there are changes, that there, instead of a plan being denied, that there needs to be a collaborative effort between the different tiers like REM and CFC and such. Right now, it doesn't seem to be that there's any plan in place as far as using the different programs. So anything would be greatly appreciated.
Good to see you tonight, Michelle. Thanks for joining us. And thanks for raising a question in regard to medical complexities. As I've said many times before, we are still continuing to provide services to individuals with medical complexity and challenges. We are looking at these cases by way of cross systems. So within the Maryland Department of Health, we work very closely with our Medicaid partners and meet monthly on these very complex cases so that there is a holistic review of the number of resources and investments in place to make certain that the person's health and welfare needs are being met. I did get your email on the one example, and so we are looking into that. But I encourage families to continue to work with their case managers as well as the regional office so that we can understand fully what the challenges are as we work very closely with the Community First Choice program as well as the Division of Nursing Services that actually operates and runs the nursing services by way of the rare and expensive case management program. So thank you so much for bringing that to our attention.
Right, we're going to go online, and then I know there were some more hands. So it's Was going to say, Mimi, I see your hand is raised. Can you unmute yourself?
Hi, yes. These are my last questions, I promise. So the first one, my personal experience, I am a support broker. I've been a support broker since 2020. I have never been a CCS and I've never used LTSS myself, but I have had quite a few CCSs over time ask me for help with navigating LTSS. So my first question is just, is there an action plan developed either by DDA or an effort with DDA and CCS agencies to improve training and managerial support for CCSs? My second question is that, again, just very short background, Central Region is known for having stricter reviewers and much longer review periods. So asking what is DDA's plan to make reviewer feedback and timelines more efficient and, for lack of better words, standardized? Thank you.
Thank you for your questions. I'm going to turn it over to Nova Evans to address your question related to coordinators of community services training. But what I will say is that under the leadership of our new Deputy Secretary Hutchinson, when she came in, we did process mapping across our system, across every process, and we are starting to look at ways that we can streamline operations, make things more efficient, but more importantly, ensure that the way we do things across the state are standardized.
Thank you. To the question about CCS training, we are doing a lot in the terms of CCS training. We meet monthly with our CCS partners. When we find concerns, we're doing training every month, and a lot of that is on LTSS. We have an LTSS representative that's on that group who shares updates and changes as they happen. We're also looking into a series, doing a CCS like micro training series. So these are important things to bring back if we're hearing that there's trends out there in the community where CCSs need more training. We welcome that feedback, but right now we're looking into a whole training plan. The other thing we're doing is meeting with CCS leadership to identify better ways to communicate, make sure that all CCS staff are getting the same training, and looking at competency base as well. So there's a lot going on in the works, and thank you for, thank you online for giving that information, because we can take that back and build that into our plan to make it stronger.
And in regard to responsiveness for person-centered plans, one of my team's service level agreements is to process a person-centered plan within 20 business days. And so again, we've looked at all of our processes. We're looking at how we can trim fat, reduce administrative burden, work very closely with our partners across the agency so that there's not a lot of back and forth. We're working to reduce that back and forth so that, again, the participant is first, families are supported, and that we can get those decisions to you as soon as possible.
All right, thank you. So, Shari, I see your hand is raised, so I'm going to read a question online to give you time to get yourself unmuted. Question, if DDA is working with a vulnerable population, what are the safety nets for these issues to ensure the population has seamless continuity? Sure, be happy to. If DDA is working with a vulnerable population, what are the safety nets for these issues to ensure the population has seamless continuity? I was going to say, so this question came from Zipporah, if I'm pronouncing your name correctly. Maybe if you could type in a little more detail, or if you could raise your hand, we'll be happy to unmute. You can unmute yourself and ask it. So How about if we do that, and then we'll move to Shari in the meantime to give Zipporah some time. Does that sound okay? All right, Shari. All right, we'll come back. Okay, I thought we saw, yep.
Thank you. And I was getting to my my third point, and she brought it up over there about when FMS or FMCSs don't make payments. Um, what recourse do we have if you're already when we're in our CSS and our support brokers are contacting the FMCSs and not getting responses, or they get a response back like, well, this wasn't in the plan. Well, there was a plan modification made. My CCS has an email that they received that, but the FCMS just kept saying, well, it's not in the plan. This is why it was mileage, was not paid. When it had been in a modification months before, for which the CCS had a verifiable that they had received it. Um, but again, like she was saying, nothing ever happened. They never paid. They went to the regional office. They reached out to, everybody that they could and got basically no response. So there are a lot of people who are not getting paid for services that are in the plan because the FMS is just not paying it. Um, there's proof to back it up. So I think her question was never really answered as far as what recourse or what is the appeals process, because you're saying reach out to the office. People are reaching out and not getting responses. Nothing's happening. I mean, it's been months, and it's kind of like, sadly, we get to the point we don't know what else to do. So you're sitting there and you're out thousands of dollars, but what can you do? And I know my question is always like, DDA, you all hire or vet the FMCSs, correct? I'm sorry. Like, do you have oversight of them? Do you have, I mean, it seems like also there's a lot being put on them that they can't handle. There's a lot of discrepancy between the ideal, this is the way things are supposed to work, and what's actually happening. And again, it's just, is there a process other than just reaching out? Because we're reaching out and nobody's answering back. So back to her question, is there a specific process or appeals process?
So I believe we answered the question. We are the escalation points. I've resolved those very type of issues that you've just flagged. The email address to contact, which is monitored by folks who are at our headquarters office, is the sds.dda@maryland.gov. We have our Director of Administrative Services, Wesley Hunteman, who monitors that and also gets involved and works with our FMCSs to try to get to some sort of resolution. Um, so that's where the escalation point. Now, I will say there are examples in which the payments are denied, and it's a legitimate reason for that. So not all payment issues can be resolved, but for payments that are proper, they usually get resolved. And once we get involved to help connect some of the dots, as you're saying, maybe it was in a budget modification, something that they aren't seeing, the individual who's the customer service rep who's working on it, we get that resolution rather quickly. But that's the answer is the let us know so that we can look into it.
And from the regional office perspective, sometimes we find out about it months after you guys have been going back and forth with the FMCS. And in the last month, I've been chasing a few of those concerns. So what I would ask again, if the coordinator says, I reached out to someone in the regional office, ask who it is. If you don't get a response, all of our information, we're on the website. It may take us a day or two to get back to you, but we do try to follow up. And what I often find is that there was a valuable piece of information that was not asked, or information was not transferred appropriately. And so where we're able to, we do figure it out. And Robert knows, because that's who we go to say, hey, the FMCS did miss something. Is it okay for us to have the payment approved? So as long as we are aware about it, it may take us a bit to review it, but in the last few months, by the time these concerns have been brought to me, it's been 2 or 3 months that the teams have been going back and forth with each other, trying to resolve it, and they did not pull us in to help out. So try to pull us in a little faster so we can try to see how we can help a little earlier.
All right, thank you. All right, Shari, are you able to unmute and ask your question? Okay, so, all right, Shari, if you're talking, you're still muted. So I'm going to go into the audience and, oop, here she is. She finally, oh, she cannot. Okay, well, if you could try to please type it into the question, and I will be happy to read it and get you an answer. All right, we'll go back into the audience.
Thank you. I just wanted to touch on a little bit about the FMCS, and because there has been success with involving community and having community input, so thank you for that piece. In terms of meeting with the FMCSs, are there any stakeholders at those weekly meetings?
There are not meeting stakeholders at those weekly meetings because they are the contractual meetings where the DDA is discussing the FMCS's contractual obligations and so forth. So they're actually performance monitoring meetings.
So a suggestion that I have is to maybe create or have someone, whether it's Wesley or whoever it may be within the office, and then the 3 fiscal management counseling services companies, as well as a few, whether it be one support broker, a CCS, and a participant, to be present so they can bring the real issues that are happening. So when I hear, speaking of trends, my concern is trends that tends to happen a few months down the road when it's too late. So um, perhaps bringing on a few stakeholders that are living this in real life and time. So then that way it doesn't get out of hand, because with the fiscal management companies, we're seeing continuous delays. It's not even if there's questions like, was there an issue with the invoice? There's zero feedback. It's almost like a smoke and mirrors response. And so if we're trying to squash what is just, or an issue that has been happening, or we needing to fix it, we're trying to resolve that issue and fix it. And we're not able to do that if we're not getting the feedback. It's just, we open up a ticket for something that hasn't been paid in a month or two, and poof, it gets paid because you open up a ticket. So that's an issue, and timely response.
Yeah, she's versus. to say thank you for that suggestion, Michelle. It's pretty timely. We're in the process of putting together a retreat with our fiscal management and counseling services agency. So we'll be certain to
So,
flag that there.
hi. So, regarding the fiscal management, actually, Mr. White, you've actually helped me a couple times because I've copied you on tickets because um, I just got paid on Friday for January through April's mileage. I turned it in July 9th. I still haven't been paid for May and June. I'm grateful that I got paid for the 4 months that I did, but it's a lot of money. And um, the other issue we have with payment is, again, Michael's horse farm. This is a horse farm he's been going to for 12 years. It's not been an issue. We know how he does not get he gets job skills training through his horse farm. He is not getting equine therapy. So his payment does not come out of IFDGS. It comes out of CDS as a vendor. Every month for the last 18 months, they have kicked it back. And I think 1 month there was an issue that there was a missing piece of paper or missing signature somewhere. But every other time it's been that the FMCS looks at it, assumes because it's a horse farm, it's processed, and then they don't tell us they're not going to pay it. They simply don't pay. And then when we contact and open a ticket, they're like, "Oh, well, you don't have any, he doesn't have any funds and a funds under IFDGS, or that farm isn't approved under IFDGS." Well, no, because it's not. We even include it in the subject line when we send it in. We include it in the body of the email that we send it. This is not an IFDGS. This is a CDS vendor. And we continue to have the issues. So I know part of it is the FMCS. They are understaffed and overworked, and I understand that. But 18 months of this happening, we're going to start losing the providers that you do have. And that would be sad. I know that a great number of support brokers left the program last year because of the changes that were issued in the first manual. So I don't want to see that happen to these programs that mean so much to our kids.
Thank you for that feedback.
So just a quick follow up on what she was saying about the FMCSs. I think I know which FMCS you're referring to, and that particular one hides behind emails and tickets. That's not the way that an FMCS should handle that. Um, so communications is key to the success of any program, and for them to hide behind a ticket system when anything is just absurd. So uh, I would just recommend that they at least open up their phones and have some kind of dialogue to get situations like that taken care of. Um, so that's just on that. But I wanted to just talk about the IFDGS. It seems, I just went through the recertification for the support broker. It seems like DDA is making it nearly impossible to put any kind of request in for that. Not only have you cut or have capped the amount of payouts per, they gave the examples in there, but the justification for requesting is just seems to be absurd for participants. Most of them are volunteering, or if they do have a job, their Social Security caps them at $2,000, so they don't have the money. But you're making it as though they have the money to buy all this stuff. If there's a request going in for, let's say, a laptop that they need to do whatever, to support on a day-to-day basis, if the justification can be written in, I think that's all that's needed, as opposed to bank statements and everything else to prove that they can, that they can't afford to buy it. So it's just, I think, a sore part. Why is it even in there if they're making it so difficult?
All right, let's try this again. Shari, can you ask your question?
Yes, thank you so much. Really appreciate it. Appreciate the DDA going and really taking a lot of time and effort to hear us. I just want to echo what was said tonight about the family of staff. I've heard at least 2 comments tonight. I've sat in on multiple meetings. I've even seen documentation on the Department of Legislative Services site that basically says negative things about family of staff. I heard Rhonda tonight talk about how family of staff can serve in the waiver, which we are currently doing. But there are many, many people, including myself, who are absolutely worried, and I'll say the word terrified, that family of staff is at risk and may no longer be able to serve at some point. Marlena, I am asking for your leadership, please, because everybody needs to hear from you that family of staff is valued, is needed, and if you talk about family of staff in a positive light, I hope that it will dissuade anybody from coming back at family of staff as negative. It is time to stop this because family of staff is needed in self-direction. We serve probably more than a majority of the participants throughout this state who are in self-direction. So we call on you, we call on your team. Please speak positively on family as staff. We want to be your partners. We are asking for your assistance. We're asking for your leadership to please, please continue to support us. Thank you.
Sherry, thank you for joining us tonight, and thank you for those comments, and thank you for all of your work and some of the work groups and platforms that you serve on to um, advocate for individuals with intellectual and developmental disabilities. I think you know that as we talk about these, as we have conversations about the both service delivery models, that my team and I are presenting data to the community. We talk about how self-direction as well as the community provider managed service delivery models are complementary. So, thank you again for your comments and feedback. We definitely are taking it into consideration. But I think you also know that when we're having those conversations, my team and I are there with data and talking about the complementary work that both service delivery models provide to the IDD community.
All right, thank you. All right, Irene, can you unmute
Yep,
and ask your question?
sure did. So I'm a very curious person. I asked my friends who have the provider model, who run provider model services and CCS services. So these are I'm asking on their behalf. One of the issues is the waiver and eligibility disabilities, the EDD services. So the concern is, where they have to continue often providing services for people who have been dropped or are not in the waiver. And because of the way that the COMAR is set up, obviously nobody wants any of the participants to be homeless, but it is a struggle for a lot of the providers to continue supporting people when they don't have the funds to support them. And is the state, like, what is being done, I guess, to work with EDD to help reduce those situations? Um, Other inconsistencies with the PCP process as it relates to PCP reviews. There's a lot of interpretation with the guidelines than following the PCP guidelines. Sorry. Most plans are delayed due to clarification requests. I just want to say, like, as Irene, that I think that maybe if there's more discussion ahead of time as far as like what are like the common issues that come up as clarification requests, that those can be, hopefully managed ahead of time. I do see that sometimes the schedules are accepted, sometimes they're not, so what can be done to kind of reduce those clarification requests? Because every time a clarification request comes out, then there's like another 20 days before the plan can be approved, or, up to 20 days. So the other issue is the COMAR and waiver rule inconsistencies. And even when I was a CCS, I remember that, the waiver, well, the regs take a lot more, I guess, time to adjust to like the waiver changes. So oftentimes I know with OHCQ surveyors, like they're going by what's in the regs and not by what's in the waiver when they're doing their surveys. So that is a struggle for the providers. Let's see here. Um, so the rates are better. So some of the positive things, rates are better, but we just want to see the state entities to follow the guidelines. Um, Also modifying the PCP document itself. It's very convoluted. So is there a way to kind of modify it so that it's easier to complete? Maybe even incorporating the SIP. Um, and DSAT and use more person-centered tools to establish a way to capture a person's needs. Lots of improvements have been made. Can't complain too much. These utilization reviews, though, that's what the comment was. Um, and then also for the CCS side, um, so there's a lot of involvement, and with current number of caseload, it's pretty much impossible to keep up with all the tasks involved. Don't know how they can make sure that CCS coming up training to do this job because it's very involved. So I mean, I think that all of us, despite whatever model that we're working with, see all of the things that the CCSs have to do and learn in a very short period of time. So I just feel like, as Irene, I'm speaking as Irene now, that if changes are made, and we really have to, consider the administrative burden that the CCSs are going through. We don't want to set up a system of where like people are feeling in order to keep their job that they have to commit fraud. So to be honest, like I had a situation that just came up where the person was, and the supervisors already know this, so I'm not saying this to get anyone in trouble, but just to give you an example, the CCS was doing a visit while holding the PCP meeting, and those are the kind of things, because it's almost impossible for them to do all of their tasks. But okay, so that's what I wanted to
I was going to
share,
say,
what my friends
Irene,
wanted to share. That's it, I'm
I,
done.
Irene, I was going to
I'm
say we're
done.
trying to limit to a minute, so that was an awful lot. So
Okay.
we're gonna pause you,
Oh,
okay?
I'm done. I'm
All
done.
right. Thank you, Irene.
Yes, thank you, Irene, and thank you for your continued advocacy and for bringing forward some suggestions for our consideration. I do want to say we are always open for suggestions on how we can improve our systems. Um, as I mentioned, we've done some process mapping. We're really digging into the data from that process mapping and changing some of some things internally related to how we do things. Want to put Bianca on the spot, our regional director for the Central Maryland Regional Office, because they're even trying something new regarding providing more technical support to our CCS agencies, which we have already demonstrated at one of our other regions has a direct correlation to decrease in clarification requests. So, Bianca.
And this is really kudos to the CCS supervisor who actually reached out and said, I really want to do a better job of supporting my staff. And would you be available to spend some time with me? So I know, and if I can support them better, we will not have some of the mistakes that we're making. So I know we sit and we talk about how the CCSs need support. We are aware, and they have been asking for support, and we have been doing our best to provide that. But I thought it was really brave of that particular supervisor to actually ask for some support. So we're scheduled to meet next week, and hopefully you will see better outcomes from that team.
In regard to the eligibility and enrollment challenges that we've been hearing about, please know the Medicaid administration is also an administration within the Maryland Department of Health. Deputy Secretary Briskin and I are literally joined at the hip. We're talking every day about the eligibility and enrollment challenges that many participants unfortunately are experiencing. And we are working very closely with external partners in regard to the interoperability challenges between the computer systems and so forth that also impact eligibility and enrollment. And so just please know that it is a high priority for not only our governor and our secretary, but both myself and Deputy Secretary Briskin to get to the bottom of the eligibility and enrollment issues. We work together daily. We look at high priority cases. One case is one case too many, in our opinion. And so just please know that it is a high priority for the department to work through the eligibility and enrollment issues.
So yes, I just as a new DDA provider, just wanted to ask, is there any process in place that providers can connect with CCS agency for communication and coordination? Is there any like a recommended process or a list of CCS contact that the DDA can share?
Please reach out to your regional office and ask for the CCS lead. We meet with the providers monthly, the CCS providers, and we can have you do we'll invite you, we can have you do an overview and tell the CCS agencies what services you're going to provide, what area, that kind of stuff. But just reach out to the CCS lead and they'll get you scheduled.
All right. I'm going to come online, go back to online, and I think I also saw a hand in the audience just a second ago, or am I? Okay. Between the online chat, so I just want to make sure. Thanks. All right, Shari, you have your hand raised to ask another question. Okay. All right. So let me check and make sure if we have any other questions online. All right. So far, we don't. Yes.
My question is, what is the definition of a Medicaid provider? What laws and regulations are they subject to? And how does, well, one question, how does DDA approval and E-PREP requirements, how do they support participant choice and employer authority?
Take the first part of the question and then have Ms. Nova Evans. So a Medicaid provider is technically anyone who accepts the money for reimbursement for services. That's technically a Medicaid provider. Medicaid providers are fall under the chapter of COMAR, which is 100936. That's the general participation regulations for Medicaid providers. And then also we have some providers that have not gone through the Medicaid enrollment process, which is known as E-PREP, um, that ties into the Medicaid provider enrollment agreement. And then I'll have Nova.
I'm going to have you repeat the second part of that question. Okay.
So can you repeat those questions since you've got a mic? That because of the
What?
folks online
Oh, I'm sorry.
that
What laws regulate?
So what are the laws and regulations that Medicaid providers are subject to? Uh, and how does DDA approval and EPREP support participant choice and employer authority?
So Deputy Secretary Hutchinson just talked about COMAR 100936. Um, providers also are beholden to 102202. So that talks about the qualified provider applications and renewals. Um, and in the waiver, it talks about Medicaid providers and that anyone that provides a Medicaid service is a Medicaid provider. The EPREP enrollment process is required to become a Medicaid provider. So once you're approved by DDA, then you go into EPREP, complete that process, and get a Medicaid number. And so you're able to bill for Medicaid services. You're technically a Maryland Medicaid provider. People have the choice to choose any provider they'd like, and based on their assessed need, they work with their CCS to identify what providers they need. So I don't know if that answers your question as far as choice, but they have the choice to engage with any service provider that they would like to have based on that.
With the caveat as it falls within the authority of the waiver and meets the requirements within the waiver. So the waiver talks about in your referring to the self-directed services model where participants could have either budget authority and or employer authority, and that's all outlined in the waiver.
Okay, we have a question online. It said, would DDA allow stakeholders to vote for their representatives to the waiver advisory and sustainability councils on a regional basis rather than DDA selecting the members?
Thank you so much for that question. For the Waiver Advisory Council, last year a law was passed that put that in Maryland law or statute. So the actual selection of members on the Waiver Advisory Council is made at the Secretary's office. And so now individuals will complete the Maryland Department of Health appointments application. It's not our application, so it goes through the Secretary's office.
Great, thank you. All right, Shari. Oh, Shari's hand was up. Now it's down. All right, Karen. I see your hand is up. If you'd like to ask your question. All right, we will work on that. Other questions or comments? Okay, so Karen, you are unmuted. Technology is good until technology is not good. Other questions, comments? Yes.
So this is about the MidSec, which is, I don't know the name of the acronym for that. Sorry. I just wanted to ask regarding utilization, is a lot of it, the discussion is about the higher level budgets, is it factored in the fact that self-direction is less costly per hour? Is that factored into the mid-sec discussion on utilization? Or how is utilization determined in the different models?
I would say that notwithstanding the forum, whether it's the Waiver Advisory Council, the Rate Review Advisory Group, et cetera, every discussion is informed by data. Um, since you brought the MidSec, I'd like to just let individuals know that we are standing up a MidSec section on our website where we'll be posting the charter as well as the membership and also giving a summary of the work that has been done um, in the MidSec and how the MidSec will help support program sustainability and equity moving forward.
All right. All right, Karen, can we try again online? All right. All right. Maybe it'll work out here in a minute. We've got her unmuted. All right. Other comments or questions from the room? All right. So Karen, you want to try again? All right, Irene?
Yes, so just want to thank everyone. I'm not sure, I might have missed if you were having, I know you want to have more, but I'm not sure if they're not going to be until after the new year, the additional sessions, but I definitely want to thank you all and Renee from Parents Place in Maryland for hosting these events. It really has been helpful, and I think that we did go a long time with like radio silence, and these sessions are going to really help people feel more connected. So, it's just the beginning, and it may take some time to build up that trust again, but I'm sure that I see it coming in that direction as long as the communication lines are open. Thank you.
Thank you.
Just to answer, so Irene, as I've been saying at all of the listening sessions, and as I said at Monday night's meeting on the Eastern Shore, we are committed to continue to have these ongoing and continuous feedback loops by way of in-person or hybrid engagements. We are coming up on holiday time, which is why we combined two regions in 2 evenings within the same week. Then we will be in the participating in the 2026 legislative session, which is 90 consecutive days. But we are committed to continue to have various platforms to receive community feedback. So please continue to look out for our notifications. More information is forthcoming.
All right. Other comments and questions? Okay.
It's just a comment on like the attendance. That message was only sent once, to my knowledge. Could you send the invitation out a couple times? People get a lot of emails and may have missed it. And, you guys spend a lot of time and effort having these. I think you'd appreciate better attendance as well. So that might help. Thank you.
Thank you. We will definitely take that back. And you're absolutely right. We want to hear from as many individuals as we can. Everyone's voice is important.
So, Robert, following up on that, one of the things I also would be helpful is not everyone gets the DDA emails, right? I get them. I'm lucky enough to get them. How can folks sign up to make sure they get the DDA? And that was not planted.
That is an excellent question. And I don't know if anyone from our professional development team have the answer to whether or not we have a dedicated email address. But this is something we uh, discuss. Like we talked about wanting to hear feedback from the community, recommendations on how we can improve things. So we're looking at that, setting up sort of a form where people can, go in and fill that out. So let me take that back and see what we can do, unless you have an answer, Rhonda, so that we can get people to opt into our emails. I also want to say I work for the state of Maryland, and sometimes those messages end up in my spam filter. And I'm like, did the connection go out? Yes, it did. And where is it? It's in my spam box. So we're trying to work internally on even changing the platform to reduce the number of our communications that get caught up in one's spam filter as well.
I was just going to add the DDA website. If you go on it, we do have a specific link that you can add information, and then you sign up, and then you would be included in all the newsletters and communications that goes out.
Great. Thank you. All right, Karen, I see your hand. Can we try again? Oh, awesome. Thank you. Thank you. Thank you. Thank you.
Okay, so it says, I am a support broker and I wanted to share some information that I learned this week from one of the FMCSs when I called, as I am owed over $10,000 in back payments since January for clients. What I learned was if a support broker puts in an invoice and the participant approves the invoice but does not approve it by the date that the vendor payments are due, the FMCS does not make the payment, and the only way you can get paid is to reach back out to them and have them run payroll from prior months. In doing this, it took over 16 hours to go back through all the invoices to just give them the dates from each month. And then I was told that they could only speak with the support broker for 45 minutes. And then they had to get off the phone and they would not go through each of my invoices with me to help. Make sure that I would make sure that I would get paid to that she could get paid. The FMCSs should be required to go back through any to see any unpaid invoices and make sure they are paid once they are approved. I have my own comment to add about that also. I've experienced this. If an invoice that I send in does not get paid, the email that it's in that I sent, they delete. I don't know any other business that operates that way. Um, my dad worked for the federal government for 42 years. You never threw away any emails. You kept them forever. He probably still has emails, even though he's been retired 20 years, or still on their server. But the fact that it's our responsibility to go back and like I'm still owed for May and June's mileage. I'm going to have to resubmit all the documentation and the forms again. That's not right. The ones that they paid me for were in the same email as the two they haven't paid. It just, some of it just logically doesn't make any sense. And I think that's her frustration as well.
And thank you for having her text that to you because we have been trying. We have been trying. So we are right at 8 o'clock. So we definitely need to wrap things up. Just so folks know, because this question was asked online, everything was recorded. All questions were captured in the online chat as well as all of yours, right? And then DDA is going to again take this back, synthesize all of it, and it will be shared with everyone as they are doing all of the pieces that they have outlaid as around in those, I think it was 5 areas. I don't have them. Oh, see, 5 areas to really improve and hear everyone's concerns. So I'd really like to thank everybody for coming out. Marlena, do you have a mic there to bring us home for the evening?
Yeah, I just can't thank everyone more for coming out, sharing your feedback, sharing your concerns, and also your recommendations. Please know that, as I said earlier, this is the beginning of a continuous and ongoing feedback loop. We really want to be at the table with all of you. We don't know everything, we don't have all of the questions, and we definitely need you to work through all of the challenges to make certain that the individuals who need these services more than anything continue to get them in a very safe and a sustainable way. So thank you so much for coming out tonight. And thanks for all of you who are online and joined us this evening as well. Take care, everybody.